What if a virus lurking in your backyard could turn deadly without warning? Picture a quiet Louisiana neighborhood, wild birds fluttering through, carrying a silent threat that claims a life. The first U.S. death from bird flu, reported in Louisiana, is a wake-up call we can't ignore. Welcome to the Healthy Start channel, where we dive into the health stories that shape our lives. Today, we're unpacking this tragic case, exploring what it means for you, and revealing how to stay safe in a world where bird flu is spreading. You won't want to miss this. Subscribe to the Healthy Start channel and hit that notification bell to stay ahead of the curve. Let's start with the headline that sent shockwaves through the health world. In January 2025, Louisiana reported the first U.S. death from H5N1 bird flu, a virus that's been simmering in the background, but it just showed its teeth. The victim was a person over 65, battling underlying health conditions, who caught the virus after contact with a backyard flock of chickens and wild birds. Think of a cozy rural property, a small coop filled with clucking hens and sparrows darting in and out, unaware they're carrying a dangerous hitchhiker. This wasn't a farm worker exposed to massive poultry operations, it was someone tending to their own birds, a scenario that hits closer to home for many. The patient was hospitalized in December 2024 with severe respiratory symptoms, fighting for life in critical condition, but sadly didn't make it. The Louisiana Department of Health confirmed the case, marking a grim milestone, the first human death from bird flu in the U.S. So, what is H5N1, and why is this death such a big deal? Bird flu, or avian influenza H5N1, is a virus that primarily infects birds, wild ones like geese and ducks, or domestic ones like chickens and turkeys. It's been around since 1997, spreading globally through migratory birds, leaving a trail of infected flocks and occasional human cases. Globally, the World Health Organization has recorded over 950 human cases, with a chilling 50% fatality rate. That's right, half of those infected worldwide have died, making H5N1 far deadlier than most seasonal flus. In the US, the virus has been quieter, with 66 confirmed cases since 2024, mostly mild, affecting farm workers exposed to sick poultry or dairy cows. But this Louisiana case was different. It wasn't mild, it wasn't linked to a commercial farm, and it ended in tragedy, raising questions about how far this virus could spread and who's at risk. Let's dig into the details of this case. The patient, whose identity remains private out of respect for their family, was exposed to both a non-commercial backyard flock, think a handful of chickens kept for eggs, and wild birds, likely visiting the same area. The virus, identified as the D1.1 genotype, is one circulating in wild birds and poultry, distinct from the B3.13 strain hitting dairy farms. Here's where it gets concerning. Genetic analysis by the CDC revealed mutations in the virus that likely developed inside the patient. These changes made it better at attaching to human upper airway cells, a step that could, in theory, make it easier to spread. Thankfully, these mutations weren't found in the birds the patient contacted, and there's no evidence of person-to-person transmission. Picture the virus as a lockpicker, tinkering with its tools inside the patient's body, but not yet escaping to others. Still, this evolution is a red flag, a sign that H5N1 is testing new ways to adapt to humans. Why did this case turn deadly? Age and health played a role. The patient was over 65, a group more vulnerable to severe outcomes from respiratory viruses. Underlying conditions, possibly heart disease, diabetes, or lung issues, likely weaken their ability to fight off the infection. But experts like Jennifer Nuzzo, director of the Pandemic Center at Brown University, warn we shouldn't dismiss this as an isolated case. A 13-year-old girl in British Columbia, Canada, was hospitalized in 2024 with the same D1.1 strain, requiring life support and intensive care. She survived, but her case shows H5N1 can strike hard across age groups. It's unpredictable, like a storm that spares one house but levels another. The Louisiana death underscores a harsh truth. While most U.S. cases have been mild, often causing just pink eye or flu-like symptoms. H5N1 has the potential to cause severe illness or worse, especially in vulnerable people. Now, let's talk about how this virus spreads. H5N1 moves through direct contact with infected animals or their bodily fluids, saliva, mucus, feces, or even raw milk from sick cows. In the Louisiana case, the patient likely handled sick or dead birds, maybe cleaning out a coop or shooing away wild birds. The virus can linger on surfaces, like feathers or feed bowls, waiting for an unsuspecting hand to brush against it. Farm workers are at highest risk, often exposed to large numbers of infected animals. But this case shows backyard hobbyists aren't immune. Picture a weekend gardener tossing scraps to their hens, unaware that a nearby crow is shedding H5N1. The virus doesn't need a big stage to make an impact. It can strike in small, everyday moments. And while person-to-person spread hasn't happened, the more the virus jumps to humans, the more chances it has to learn that trick. What's the bigger picture? H5N1 is everywhere. Since 2022, it's infected wild birds in all 50 states, killed nearly 130 million poultry, and spread to 917 dairy herds. California declared a state of emergency in 2024 after outbreaks in cows, and pets like cats have tested positive in states like Louisiana. The virus is a shapeshifter, moving from birds to mammals, cows, ferrets, even seals, giving it more opportunities to mutate. Posts on X reflect public concern, with users like @ShadowofEzra noting the CDC's findings on the Louisiana patient's mutations, hinting at fears of easier human transmission. Others, like @HelenBurns, flagged the case's severity early, comparing it to the Canadian teen's ordeal. This isn't just a human health issue, it's an environmental one, tied to how we interact with animals and manage our ecosystems. So, why aren't we panicking? The CDC and Louisiana health officials stress that the risk to the general public remains low. Most cases are tied to direct animal exposure, and there's no sustained human-to-human spread, unlike COVID-19 in its early days. But experts aren't complacent. Dr. Amesh Adalia from Johns Hopkins calls H5N1 a serious threat with a history of deadly outcomes. The virus's mutations in the Louisiana patient, and a similar case in Canada, show it's probing for ways to adapt. If it cracks the code for human transmission, we could face a much bigger problem. Think of it like a smoldering campfire. One spark in the wrong place could ignite a blaze. That's why surveillance, testing, and prevention are critical right now. What can you do to stay safe? First, avoid contact with sick or dead birds, whether they're wild or in your backyard. If you keep chickens, watch for signs of illness, lethargy, ruffled feathers, or sudden deaths and report them to the USDA at 1-866-653-6593 or Louisiana's Diagnostic Lab at 318-927-3441. Second, use protective gear if you must handle animals. Gloves, masks, and eye protection can block the virus from sneaking in. Third, steer clear of raw milk or undercooked poultry. Cooking kills H5N1. So make sure eggs and meat hit safe temperatures. Fourth, get your seasonal flu shot. It won't stop bird flu, but it reduces the risk of co-infection, which can worsen outcomes. Finally, if you've been around sick animals and developed symptoms like fever, cough, or pink eye within 10 days, tell your doctor about your exposure. Early treatment with antivirals like Tamiflu can make a difference. Let's zoom out. This death is a reminder that our health is tied to the world around us. H5N1 isn't just a virus, it's a signal of how closely humans, animals, and environments are connected. Wild birds carry it across continents. Backyard flocks bring it to our doorsteps. Dairy farms amplify it in unexpected ways. And each infection is a roll of the dice, a chance for the virus to evolve. The Louisiana case, while tragic, is also a call to action. We need better surveillance, not just of humans, but of animals, cows, birds, even pets. We need public awareness campaigns to teach people the risks of handling wildlife. And we need research to stay ahead of H5N1's next move. Are we doing enough to keep this virus in check? Or are we waiting for the next spark to catch? The good news: we have tools to fight back. Antivirals work if given early. Vaccines for H5N1 exist and could be scaled up if needed. Testing is improving, with bulk milk tests helping track the virus in dairy herds. But we can't rely on tools alone. It takes vigilance, farmers checking their flocks, hunters avoiding sick game, and everyday folks staying informed. Picture a community where everyone knows the signs, takes precautions, and speaks up when something's wrong. That's the kind of resilience we need. The Louisiana death is a loss, but it's also a chance to learn, adapt, and protect ourselves before H5N1 makes its next move. As we wrap up, let's reflect on what this means for you. Health isn't just about dodging a virus, it's about understanding the risks around you and taking small, smart steps to stay safe. Whether you're tending a backyard coot, hiking near a lake, or just curious about the world, knowledge is your best defense. Keep learning, keep asking questions, and keep your health first. The story of H5N1 is still unfolding, and you can be part of the solution. Subscribe to the Healthy Start channel, click the notification bell so you don't miss the next valuable videos. Goodbye and see you again.